Good afternoon. This is Dr. Jeff Gelblum, your neurologist from down here in sunny South Florida, board member at First Choice Neurology, a large neuro group based down here in the Sunshine State. And today's discussion is going to talk about some fun things that we can do in the time of coronavirus. We've all been under quarantine. We've been under lockdown. It's time to think about re-engaging, re-emerging, getting on that roadmap to normalcy. And that's the purpose of today's discussion. Last time we met, we had a very nice overview of the various types of vaccine technologies that are in play right now with the hopes of bringing a vaccine, which will be a big sigh of relief to all of us who are wishing to re-engage with the world and like to get vaccines. I myself am a pro-vaxxer. If you're talking to an anti-vaxxer, they're going to have to sign off and go somewhere else to get their information. But for purposes of today's visit, today's discussion, whereby we've got to have some fun with our lives right now because we've all been cooped up for 2 months, and it's beautiful sunny weather over most of the country. So for those of us who are looking to re-engage, to get some fun, that's where we're going to focus on today's discussion. So today's going to be a fun discussion, not a wonky discussion. You're not going to need an envelope for today's discussion. Remember, previously on our wonkier discussions, you needed an envelope and a pen to jot down some notes. You're not going to need any of that. So for purposes of today, we're going to talk about the ABCs of having fun in the time of coronavirus. And remember, we are probably not only in a pandemic, but we are in an endemic, meaning the coronavirus is here to stay. It is here to stay for the foreseeable future until a vaccine is brought to all of us. So we have to think of this virus as being an endemic. It is part of our day in, day out life. So when we think of something in terms of an endemic, we have to say, what is my risk of getting sick? And what is your risk of getting sick? Because every interaction, every engagement that we have with another person, unless we're living in a bubble, is a matter of me and a matter of you. So for every activity that I anticipate, what always must go through my mind is, how is this going to potentially infect me? And how will this potentially infect you? So those are 2 points that always have to go into our minds simultaneously. So for purposes of today's A, B, and C activities, what are the safest things? What are the next safest things? And what are the marginally safe things? That's the A, the B, and the C. We're going to talk about how we can calculate my risk as it interfaces with your risk, because at all times, the two scenarios have to go hand in hand. So let's get back to our old concept of what allows infection. What allows the coronavirus to go from one person to another person? And for that, we have to rely upon our old friend called the R0. What is R0? R0 is the ability of an infectious agent to infect other people or to infect yourself. And there's 4 components to R0, meaning the rate at which the virus can reproduce and cause contagion. There are 4 components: duration of disease, opportunity, transmission, and then susceptibility. Well, there's not much we can do about the duration of the disease because that's a fixed feature of the coronavirus and there is some variability there. There's not a lot that I'm going to be able to help you with in terms of susceptibility, meaning if you're old, I can't help you there. If you've got a history of hypertension, diabetes, pulmonary disease, well, we treat that. That's as much as I can help you. But that defines your susceptibility. Where I can help you is with the O and the T. I can help you certainly with the opportunity to infect and the transmission of infection. So when we look at social distancing, we're talking about opportunity. When we're looking about wearing a mask, we're talking about transmission. So that's why people sometimes ask all the time, well, if I'm wearing a mask, why do I have to social distance? Because they're 2 independent variables that comprise the 4-part picture of susceptibility. O is opportunity, meaning social distancing, the ability that I get close to you in order that I can breathe on you or sneeze on you, hence the projection of the infectious particle. And then the transmission, which is if I have a mask on, covering my nose and my mouth together. I've had too many people wearing masks like this. Sorry, that doesn't cut it because all the particulate infectious agents are coming out of your nose. So unless you're wearing a mask like this, if you can clearly understand them, they're not wearing the mask the right way. So basically, when we talk about social distancing, we're talking about the opportunity to infect. When we're talking about transmission, we're talking about masking and the ability to transmit that infectious agent. So remember, there's always 4 components to getting sick from an infection: duration of illness, opportunity of getting sick, the transmission by which you get sick, and then your susceptibility. So for example, in an infectious disease like AIDS, the opportunity is, well, you have to get close to somebody, and then the T, the transmission, is you have to have sexual relations with that individual. So O and T fall into any infectious assessment in terms of trying to determine the contagibility, the reproducibility of that virus, the ability to cause epidemic, pandemic, endemic, etc. So remember O and T. When we talk about social distancing, we're talking about O, opportunity of transmission. When we're talking about wearing a mask, we're talking about T, transmission of infection. And both of those have to be simultaneously addressed when we're in various situations. And the situations that we're going to talk about are me and you. When you and I are getting together, that is an opportunity of transmission. So let's talk about really safe and fun things that we can do right now, June 1, to have a good time in the time of coronavirus. So what's the first thing? Any type of outdoor exercise that you're doing by yourself, yoga, fast bike riding, jogging, swimming in the ocean away from other people, safe. Basically, no opportunity of transmission, and T, no ability to transmit to another person because you're not respiring onto that other person. And many times I'm asked, well, if you're swimming, do you need to wear a face cover? No, because then how could you breathe? You can't swim with a mask. If you're bike riding quickly down the street, or you're jogging down the street, or you're strolling down the street, do you need to wear a mask? You're only going to need to wear a mask if you are going to encounter other people. Again, the you and me simultaneous assessment that must always occur. So if you're walking down hidden lane somewhere in the country, if you're walking on the beach by yourself, if you're swimming by yourself, there's no transmissibility and there's no opportunity. So we've talked about jogging, we've talked about riding a bike, we've talked about swimming in the ocean. What about a swimming pool? Can the virus T transmit in swimming pool water? The answer is no. A swimming pool is chlorinated. We know that chlorine instantly will deactivate microbes. So there's no opportunity to catch or to transmit coronavirus in a swimming pool. Now, what about the O? What about the ability to get close to somebody else and sneeze on them as you're just coming up for air? Well, that's an opportunity of transmission. So that's why it's recommended that if you are in a swimming pool, you stay in your lane if you're liking to do laps, or if you're just splashing around having fun, then you keep your social distance from other bathers in the pool. But all of these are very, very safe activities. So outdoor exercise is absolutely safe. The risk of me infecting you is minimal. The risk of you infecting me is minimal. So outdoor activities, definitely partake of them in the summertime because this is the benefits of the nice warm weather, and you want to get your vitamin D, your fresh air, and your sunshine. Remember, vitamin D is an immune booster, so it helps keep you strong. Everybody's been locked up for 2 months, so clearly fresh air is imperative. And I also want to remind you that people are always concerned about, well, what if I touch a surface? What if I come up on the swimming pool and I hold on to the guardrail and somebody has sneezed on that? Well, remember, under strong UV light, which is what we get during summertime hours, the coronavirus probably dies within 2 minutes. So the likelihood of you touching something outdoors and getting sick is minimal. Now, Claude has a question. What about an indoor pool? Well, an indoor pool is fine because you've got the chlorine in the water. So as long as you're swimming in your own lane, Claude, you're not going to have to worry because you are socially distant. So therefore, you're minimizing your opportunity to infect. And then because the water is chlorinated, you're minimizing your transmission capability. Now, if you get out of the pool and you touch guardrails or other surfaces that have been touched by other people, instantly you're not going to rub your eyes or rub your nose because that's not what we're doing now. Nobody's touching their face anymore. So basically what you do when you get out of that pool is you just shower off, put some soap and water on, and voila, all the virus goes away. So soap and water is a great disinfectant. Chlorine water from a swimming pool is a great disinfectant. So if you have access, Claude, to an indoor swimming pool, and that's how you like to maintain your physical fitness, then I highly recommend just keep swimming, maintain your distance, 6 feet, stay in your lane, make sure you have a nice backstroke and a crawl so that nobody's going to kick you out of your lane claiming you don't know what you're doing, and enjoy your indoor swimming pool. Outdoor swimming pool, obviously a little bit safer. Why? Because the direct sunlight will deactivate the coronavirus in approximately 2 minutes. So outdoor exercise by yourself, absolutely the safest thing that you can do. Indoor swimming if you like it, indoor biking, all of those things fine. However, once we start to talk about a gymnasium experience with other people, we're going from an A level of safety down to the C level of safety. So we're not going to have a discussion about gymnasiums right now. All of you are used to exercising outdoors. It's a heck of a lot healthier anyway. So let's talk about some other outdoor activities that we should all be engaged in right now because it's beautiful summer, and let's take advantage of the nice weather. Visiting friends on an outdoor terrace. Absolutely safe. If you want to go visit your friends and go outside and have some drinks under the pergola or wherever you want to go, it's fine. And the reason why it's fine is because the fresh air is great. As long as you're socially distant with 6 feet, it's fine. And the opportunity to transmit is very much minimized. Now, when you take it from the outdoor drinks to the outdoor dinner party, that's also an extremely safe and easy activity, something very fun. Remember, a lot of our social activities revolve around food and beverage. And nowadays it's hard to say, oh, let's meet at the museum for an afternoon of fine art appreciation. Many of the museums are still closed. So if you want to get together with people, historically, it's in the context of food and beverage. So let's talk about food and beverage situations that are extremely safe. Well, outdoor dining with close family or close friends, maintaining 6 feet social distance automatically limits the opportunity of transmission. And then as long as you are using disposable cups, disposable can of beer, champagne that is poured by one person and not touched by other people, as long as you adhere to those minimizing capabilities of transmission, you're going to be just fine. Do you have to wear a mask outdoors when you're with friends? No, as long as you're not all touching the same utensils and as long as you're not infectious, there's no reason for you to have to wear a mask, assuming you stay 6 feet from other people outdoors. And that goes for dining, it goes for drinking. Now, I want to remind you that if you want to have an outdoor dinner party, if you are preparing the meal ahead of time for me, again, getting back into this you and me algorithm, probably the best thing that you can do is prepare outdoor, have outdoor setup, cooked food without sharing utensils. So make a big pot of chili, make a boeuf bourguignon, make a big lasagna, serve it hot. If you start with cold salads and other types of foods, or you bring food out fruit in, for example, from a caterer or ready to go from Whole Foods or Fresh Market, you always have to be concerned that during that transport process, someone has infected the food. And this is what I always say: if you eat hot cooked food, I don't care where you go in the world, as long as it's boiling and bubbling, you're never going to get sick. So an outdoor cocktail party, fine. Outdoor dinner party, as long as the food is cooked, is great. If you're calling the sushi chef down the street to bring in sushi, that I would not recommend, because at that point you're looking at cold items that do have the potential for viral transmission. So outdoor hot cooked food, everybody, you have to learn how to cook a good chili and make a good lasagna, boeuf bourguignon. Invite your friends over. I'll be the first one to come because it's going to be delicious. So in that regard, outdoor events are always a safe opportunity. Debbie, I'm going to get to the hair salon in a minute, okay? We're going to get there. So obviously, safest thing that we can do right now are outdoor by yourself. That's perfectly safe, zero chance. Minimal chance is outdoor engagement with friends and loved ones. So that really covers the level A areas of activity, and we're talking about fun stuff. So what can I do that's fun? Well, right now, go outside, take a jog down the street, take a bike ride, get into the swimming pool, go do your laps. All of this is fun. If you do it by yourself, zero risk. If you want to do it with a friend, no worries. Just make sure that you maintain your 6 feet. And I am going to get Amy to the idea of a hair salon, because I know the roots are showing and you need to know whether you can get your color, okay? So I got it. So let's talk about some B-level activities, meaning moderate risk, but still something that I'm willing to assume in terms of a risk. So let's get to this hair salon business. All right, all of us, well, not me, because I don't go to a hair salon, but I do feel your pain. I can empathize. So for those of you who need your roots done, what about going to the salon? Well, let's get back to our old friends O and T. Opportunity to infect and transmission of infection. Well, the opportunity is there because you are close to your stylist. So that variable can't really be enforced, meaning you can't be 6 feet from your stylist unless they're Edward Scissorhands and they can cut you from 6 feet away. So the opportunity to infect is there. You can't mitigate the O variable, Amy. So that can't be addressed. But certainly the T, the transmission, can be mitigated. So in most salons that I'm aware of now, not only are the stylists masked at nose and mouth, but also with eyes. So with that type of masking, then the capacity to transmit is greatly minimized. So overall, that's why I give a hair salon or a nail salon experience a grade of B, because the opportunity to get 6 feet away is not there. So the opportunity variable is not able to be addressed, but certainly the transmission variable. And remember, to get optimum safety, you've got to have O plus T. You've got to have opportunity to transmit, and then the actual transmission process, which is the sneezing, the coughing, the loud talking, the singing, etc. So T and O need to be thought about at all times simultaneously in every experience you have. Duration, opportunity, transmission, susceptibility. We can't control the D, we can't control the S, but we certainly can always control O and T. So when it comes to nail salon, hair salon, barbershop, not a lot we can do about the opportunity, because opportunity is mitigated by social distancing, but a lot that we can do about transmission. So therefore, as long as that as long as the stylist has a facial guard, then and as long as you have your mask on, then there is, I would say, not great risk. I'm not going to say zero risk, but not great risk of getting sick or of infecting. And I want to remind you, again, the thing we always have to think about, what's my risk of getting infected and what's my risk of infecting you? So clearly it's always this me and you dialogue that has to occur with any interaction. It's like the dating game all over again. What's my risk of getting sick, and then how much of a risk do I convey to you? One of the questions that I get all the time is, well, gee, I'd really like to have my housekeeper come in and clean my house because, I haven't cleaned the toilet in 10 years and I don't want to start now, for those 1%ers who have that type of commentary. But you have to ask yourself, what's your risk of infecting the housekeeper? Chances are your housekeeper, and I don't want to get political here, but chances are your housekeeper may not have health insurance. They may be working several jobs at once. They may have kids at home. They may be a single parent. So you have to say to yourself, well, I'm so concerned that my housekeeper is going to infect me. Maybe you should also be concerned about infecting your housekeeper. So therefore, it is my recommendation that when you have a housekeeper in your home, that you are masked and your housekeeper is masked, because the last thing you want to do is get your housekeeper sick. So therefore, it's always this me and you back and forth dialogue which has to occur. So if I'm talking about things that are minimal risk but still with a risk, I think it's important to think about what's your risk of infection and then what's your risk of infecting someone else. And a lot of people say, well, I'm not even going to be in the house when the housekeeper's there. It's probably a good idea anyway, because chances are they're not going to vacuum the way they should, and they never have. But when the housekeeper is there, if you're not there, then you're lowering your chance of infecting them. So you're helping that individual out. So it's a good idea to mask when you are having workmen and other employees in your home, and also they should be masked as well. And I want to remind you that the mask that we all wear only prevents you from infecting someone else. It's not going to be all that effective in preventing someone else from infecting you, because remember, eyes are a route of entry, nose is a route of entry, mouth is a route of entry. So you're not masking your eyes, and unless you're wearing an N95 mask, and even an N95 mask is not a perfect device to prevent infection. The mask that you're wearing, the cloth mask that you're wearing, the Vuitton scarf that all the fashionistas have over their face, that's not going to prevent you from getting infected, because there's nothing about a scarf that in any way can filter out microscopic viral particles. All it's doing is preventing your aerosol droplets from being distributed into the atmosphere. So a mask is good for you to help someone else. It doesn't do much for someone else to help you. So of course we recommend a mask. Hey, if you want to walk around with an N95 mask, that's a better mask than just a plain old cloth mask, and certainly better than a scarf or anything else. But the mask limits your contagiousness by limiting your transmission. So therefore, if you want to come up with the assessment of how do I deal with my housekeeper, you say, all right, I'm going to leave the house when they're there, so that minimizes the opportunity. And when they're in my house, I want them to wear a mask, because that minimizes their transmission. And if I must be home with that individual or that workman, I'm going to wear a mask so that I can protect my housekeeper. So that's all very, very important, because we're now reopening and we've got to get these folks back to work. We've got to start to make sure that all of these people, like housekeepers, service personnel, bus boys, they need to come back to work, because the economy has been shut down and these people need to eat. So it's very important that we start to re-engage and very strongly re-employ these people. So when it comes to going to the hair salon, there's not a lot you're going to do with opportunity, meaning social distancing, but there's a lot that's being done with transmission. And certainly now the salons are in an immaculate, sanitized state, so the likelihood of picking anything up from a surface is just remote. And while I talk about picking things up, I want to spend a moment talking about gloves. If I see one more person, it's just as disgusting as wearing scrubs outside of the hospital if you're not in the OR. If I see one more person out on the street with a pair of gloves, I'm going to smack them. Because the moment you touch something is the moment that glove is infected. And because that glove has a nylon surface, it's going to now spread that. It's going to stay on there and spread that. If you're concerned about touching things, then wash your hands or use your Purell. But people who are wearing gloves, they really, maybe this is a little bit much, should probably have their hands chopped off, because the continued wearing of the same pair of gloves is not only disgusting, but it is more of an infectious risk than anything else. Just wash your hands and Purell. That's the safest thing that you can do. So let's talk about our least safe types of activities for the summer. All right, we've all been cooped up. We all want to travel. We all want to go somewhere. So what about taking an airplane ride somewhere? All right. So we have to go back to our old friends, O&T, opportunity and transmission. Opportunity, there is no way you're ever going to social distance 6 feet on an airplane. I don't care if they block out the middle seat. I don't care if it takes them 4 hours to board the plane, rear to front, front to rear, top to bottom, upside down. It's not going to happen. So therefore, you have to say there is zero opportunity to social distance. So therefore, my O variable is infinite. I just am close to other people. My O variable of our R-naught equation is infinite. And then what about my T variable, the ability to transmit? Well, as long as I'm wearing the mask, I'm not going to get you sick. But if you're not wearing the mask, you're going to get me sick. So it's imperative that if you want to travel, you make sure that the airline enforces universal masking. Is this being done? No. So obviously my thinking is, if you got to travel for got to, but is there a reason why you should be traveling for an unnecessary activity? Probably not. I think this is going to be a good summer to see America first. So you'll be able to get in your car. A lot of people have asked me about, what about train travel? Well, at least on a train, you're a little bit more distant from other people. So the opportunity to mitigate viral reproduction is there. You've got a good O capability. And then as long as you're masked, you're not going to infect other people. And assuming other folks on that train are masked, the likelihood of transmission is going to be really good. Obviously, I'm recommending that everything be sanitized, and if you have to pick a seat on an airplane, pick the window seat, because you don't have people walking back and forth on the way to the restroom. And obviously, the restroom on an airplane was always filthy. So if you're going to use it, just touch everything with a paper towel, and then throw your towel outside the airplane in the trash bin by the galley as you open up the door, and really try and limit your hand contact on an airplane. Remember, airplane air is okay. The airplanes use a HEPA filter, high efficiency particle air filtration system. So airplane air is actually okay, but it's the aerosolization, it's the close contact with everybody else on an airplane that makes it impossible to address the O variable, which is opportunity to transmit infection, and the T variable, because everybody is not masking. So that's where airplane travel becomes problematic. My recommendation at this point is, if you need to travel for business or because of family commitments, then that should be done. But just to get on a flight and go to Rome because you feel like having lunch on the Spanish Steps, where you can't even sit anymore because it's illegal now. You have to walk up the steps. You can't sit on the steps. I think for this summer, we're going to be taking our vacation to Key West, or maybe driving up to Asheville, North Carolina, and looking at the Biltmore property. Now, let's talk about going to a hotel. What about staying in a hotel if you're going to see America first? What about getting in the Winnebago and visiting some hotels? Kind of like Schitt's Creek. Is that an opportunity that we should be thinking about? I think that a hotel environment is going to be a relatively safe environment. The hotel rooms are clean, and if you go with your spritzer of Lysol and your Clorox wipes, you should not have a problem there. The likelihood of that hotel maintaining an infectious state is going to be very low. So I think that traveling with friends, with a small group, if you want to travel with masks so that your risk of infecting your friends is mitigated, then clearly a local trip, a vacation trip to a hotel motel is probably a reasonably safe experience. I would rate that as a level B, not as low as a level C, which would be flying or getting involved in some situation where there's an impossible opportunity to social distance. And then I want to spend the last moment a little bit political here. What about going out and protesting? We've all been through some very rough time in this country, in the United States, over the past week, and people feel the need to protest. And that's a good thing, but obviously, of course, the most dangerous thing you can do is riot, because then you run the risk of getting shot. But if you want to protest, and you want to protest peacefully, I do recommend that you wear a mask, because that limits your ability to infect others. However, if there are people in that protest group who are not masked, then they can infect you. So if you need to go out, make a statement, please feel free to do so. Go. That's our right and our expectation as Americans. But it must be within an eye toward social distancing and masking. Otherwise, we could see a huge upsurge in COVID-19 in those communities which are actively protesting right now. So if you want to protest, great idea. Do it peacefully. Otherwise, you do run the risk of getting hurt within the protest, which is a far greater risk than catching coronavirus and getting sick from it. And then, of course, if you are going to engage in that type of social action, it's important that you mask and social distance. And then the last thing I want to bring up is, what about voting? We in the United States are getting excited about the presidential election in November. What about live voting? Well, live voting is fine as long as you're wearing a mask and as long as you're social distancing at the polls. And if they give you a document, the paper document, you want to make sure that your hands are Purelled before you touch the document. You fill out what you need to fill out. Do not ever touch your face. And then feed the document, the paper document, back into the machine. Obviously, the safest opportunity would be to vote by mail, and hopefully many states will allow that to occur in an unrestricted fashion this year. So we've covered a lot of information. What I've tried to do is say, look, coronavirus is endemic. It's going to be with us until the vaccine comes. I'm always optimistic. I believe that we will have a vaccine probably within the next 12 to 18 months of some sort. But remember, the vaccine may not be applicable for everyone. So in the meantime, we have to live with the endemic process of coronavirus. So what I've done today is I've given you the A, B's, and C's of corona. A, safe, outdoor, social distancing, fresh air, sunshine, it's all good. B, indoor activities that are considered to be safe would be going to a salon, engaging with your housekeeper as long as both of you are masked, going into a restaurant where you're 6 feet away from other people, and not having a group larger than 4 people. Stay away from the buffet. Stay away from the salad bar. Obviously, you want to stay away from them anyway, because what's on today's buffet was the stuff they couldn't sell from last Friday. But stay away from all of that, and I think most restaurants are not going to be serving buffet food. But remember, if you go on vacation, don't expect to get that great breakfast bar at the Ritz-Carlton in Portofino. It's not going to be there this year, and hopefully they'll have some guy ladling out the mortadella and the mozzarella on your breakfast plate. But the idea of a breakfast buffet, the idea of the all-you-can-eat salad bar at Olive Garden, those days are gone, at least for the time being, until we come up with a vaccine. And then the least safe types of activities would be where it's absolutely impossible to social distance, such as air travel, and where there's erratic transmission mitigation, meaning people are not all masked, as well as in a group demonstration where people are not all masked and they're very close together. So we've covered a lot of information. At all times, I want you to remember, what is my risk of infecting you and what is your risk of infecting me? Because it's a two-way street. It's a two-way street with family. It's a two-way street with friends. It's a two-way street with our housekeeper. It's a two-way street with the guy who comes to fix my disposal. It's always a two-way street, opportunity and transmission. Think about those two variables that go into the whole idea of viral infection. And if you're constantly thinking about what's my opportunity to transmit, how do I mitigate it? Staying 6 feet away. What's my ability to transmit? How do I mitigate it? Putting on a mask so that I'm not spewing out viral particles. Then at that point, you can govern yourself, always safely, and an understanding of the relative risk. And then people say, well, what's absolutely risk-free? Nothing's risk-free. If you want risk-free, stay in bed, but you still could die in bed of a heart attack. So there's nothing on planet Earth that's risk-free. But with the things that I've discussed with you today, you can have an enjoyable summer. You can go and visit whom you wish to visit. You can engage the way you want to engage and get out of your house, get off of Facebook right now, go outside, get some fresh air, have a really good day, wear your mask if you have to engage with someone, and then don't get closer than 6 feet unless it's somebody that you're sleeping with. And on that note, I'm going to wish you all a wonderful afternoon. Stay safe, and I'll be back again with our roadmap to re-engagement. Have a good day, everybody. Nice to see you. Bye-bye.